Okay, Hazel, I think we can get started again, and people can catch up. We go know a little bit of time, so you can go ahead and get started.
Thank you. Hello, everyone, again. I just introduced myself very briefly. I can start my presentation. I'm talking about my PhD thesis topic as title Efficiency of the Technology-Based Home Care Family EmPow for Children with Cancer and Their Parents. When we look to home-based care needs, children with cancer and their parents, uh, children cancer treatment in intensive and prolonged process, and the process can impose significant physical, psychological, social challenge for children with cancer and their parents in both hospital and the home care process. Currently, home care becomes increasingly important. In pediatric oncology, children may require assistance with symptom management, coping with emotions, and communication with parents. And while the parents need psychological support and empowerment to meet their child's care needs, also, technology-based intervention has shown the promise addressing the diverse needs, children with cancer and their families, and enhance disease monitoring, symptom management, psychosocial adaptation. When we look to gaps in evidence-based literature, the home-based pediatric cancer care, um, we look to unmet needs. Current interventions show that address the psychosocial empowerment needs of children with cancer and their parents in the home-based care setting. There is a notable gap in technology-based program to evaluate impact on both children and parents simultaneously. Also, the program aims to fill the gap to providing a comprehensive technology-based intervention and theoretical-based intervention. Uh, we can see the aim and hypothesis of our study. The aim evaluate to effectiveness technology-based psychosocial empowerment intervention. To program call it as a HomeCARE-Family EmPow for home care of children with cancer and their parents. The study hypothesis is improvement children's self-efficacy, reduced anxiety, and enhanced coping skill, as well as increased self-efficacy, problem-solving skill, and psychological resilience in parents. Our study design and methodology. The study was planned parallel groups, randomized controlled trial. Participants we randomly assigned to interventional control group using a stratified block randomization method. The study includes 64 children with cancer and their parents, children aged with 8 and 18 years. Inclusion criteria of study receiving cancer treatment, having access to the digital device, and agreeing to participate to study. Exclusion criteria of the study: new diagnosed children or terminal phase or other have a other significant illness. When we look to the intervention program, the program is web-based program, a 4-week intervention delivered through the website, providing accessibility and flexibility for participants to complete the program or pace. Intervention includes 4 modules for parents, 2 modules for children, address their unique needs, and empowering them to manage the home-based care process. Also, the intervention program grounded in psychological empowerment theory. The psychological empowerment theory has the three components. One of the component is interpersonal component. The components provides individuals thought and themselves and their self-awareness, emotions, and self-efficacy. Interactional components uh, focus on the person's goals, decision-making process, and problem-solving skill. And the last components of the theory, behavioral components. This component includes proactive coping skill and our coping behavior. Our study includes two modules for children, four modules for parents. When we look to content of children module, module one title is Discover a Way to Notice My Emotions and Thoughts at Home. The module one's content is symptom experience at home, emotions and thoughts about symptom experience at home, activity for recognized emotion, and motivational messages. Also, a supportive intervention is as an interactive method in this module. When we look to module 2, it is titled Empowering Myself, the Art of the Coping. The module's content is coping effectively with symptom and solving problem at home, problem solving stage, problem solving activity, and motivational messages. Uh, Two modules for children aim to support children's self-efficacy, enable them to recognize and manage their emotions, and develop their proactive coping skill. When we look to content of the parents module, the parents module 1 is titled Navigating the Home Care Together, Understanding Myself and My Children. The module content is being aware of the emotion and thoughts, and then how to develop emotional awareness at home. The last content of this module, managing emotions together at home. Supportive interactive methods, this module, the 80/20 rule in emotion management, finding a balance. When we saw the module 2 for parents, is titled Effective Interaction in Home Care. We can module 2 concept that support effective interaction with your child at home. Sorry. Answer to your child's frequently asked questions at home, conscientious and supportive answers. Factors that can support communication at home, awareness of reactive, proactive language patterns, and developing self-management skill by communication effectively with your child at home. Interactive method is the model, example of proactive, reactive language patterns and book recommendation. When we look to module 3 for parents, as titled, Coping Skill at Home, The Journey to Empowerment, we can saw the content of this module, active coping and problem solving skill for situation experience at home, problem solving stage, problem solving activity, and motivational message. In this module, we can use the interactive methods, deep breathing, relaxation meditation, finding inner power, and motivational letter. The last module for module 4 parents is titled Reinforcement Model Upper Perspective. The module content is providing an upper perspective to previous modules, goal settings, making sense life throughout your child's illness, and seeing a big picture. Big picture. Um, all of the parents module interventions aims to enhance and developing self-efficacy, coping skills, and psychological resilience in parents. Outcome measures and evaluations. Our main outcome is children and parents' outcomes. Also, we assess the process evaluation of the study. Measures of children with cancer, we use the some validated scale, general self-efficacy scale, pediatric cancer version, state rate anxiety intervention for children, and pediatric cancer coping scale. Also, we use some measurement tools for parents, uh, general self-efficacy scale, problem-solving intervention inventory, psychological resilience scale for parents of children with cancer. Also, we assess the process evaluation for website analytics, fidelity, dose received and reach, context monitoring, and participant qualitative or quantitative feedback. Data measure collected the 3 time points: baseline, uh, before the intervention, uh, post second assessments, 1 week after the intervention, and last assessments will be 1 month after the intervention to the program. We can say the study timeline, study periods, enrollments, recruitments, allocation, intervention, and evaluation process of the study, the summary of the study timeline. In the slide, we can solve the program flow charts before the program, intervention program, and first and second follow-up. Can we solve the program flowchart? The study some expected strengths and limitations. The study strengths includes is randomized control train, theory-based and technology-based intervention. The program provides comprehensive and evidence-based situation for home-based pediatric cancer care. Also, the study have potential some limitations, include subjective nature of emotion and psychosocial factors, technology access and digital literacy barriers, and potential difference in outcome between age group or cancer type. As a conclusion, the program HomeCARE-Family EmPow program aims to provide comprehensive, holistic, evidence-based approach to supporting children with cancer and their families during the home-based care process. The study findings have a potential to contribute to development of innovative and effective technology-based psychosocial intervention in pediatric oncology, enhance the overall well-being of children and their families. Uh, if the program is a successful, the implementation of the program may lead to integration to technology-based psychosocial support into the home-based pediatric cancer care strategies, improving quality of life for children and their parents. Our study protocol was published in seminars in oncology nursing. If you are interested, you can access by scanning the codes below. My reference is, you know. Thank you for interest and attention. I hope present main results of my PhD thesis, SIOP 2025 in Amsterdam. Thank you for interest and attention patiently.
Awesome. Thank you so much, Hazel. That was a great presentation. I loved your slides, and I'm so excited that you plan to present this or submit it to SIOP in 2025. I think it is such an amazing research project that you've worked on.
I
And
hope to
I
reach
really,
the
yeah.
other year SIOP Congress.
Yes, I think that's great.
Thank you
I
so
have a
much.
couple questions. Do you plan to um, kind of study this at more centers, or have you thought about doing it even maybe in a different country? It might be interesting to see the results between a different center in a different country and the results you found at yours.
The study generalized different country and the results compare each other. Therefore, we need to more study about this area and pediatric home-based cancer care. But when we look the literature, the file is very limited study. In our country, in Turkey, first study focus on the home-based pediatric cancer care.
Yeah, I think it's great. I really liked it, and I really appreciate you sharing your research with us. So thank you. Does anyone else have any
We need
questions?
more study about this effectiveness of the program. Lots of study.
Yes, agree.
Thank you so much. Is there any question or suggestion in my presentation?
Thank you, Hazal. I think it was a very nice presentation,
Thank you,
and
Shanila.
it can be actually used in collaboration with other low and middle income countries where home-based care is a very new concept, and I think that it would be really helpful to the children who live afar and cannot go to the healthcare facilities, that they can be taken care of at their own settings and home.
Thank you, Shanila. We focus main outcomes and psychosocial aspect, but the website we have a physician symptom recommendation for children and parents for home care, and symptom assessment tool to the website. We use this data, process evaluation data, not our main results, but very comprehensive study for focus on the pediatric home-based cancer care. I also agree with you.
Thank you. I think
I
that
need
it's
to
amazing. If you
comprehensive
have,
study.
yeah, go ahead, go ahead.
Oh, so finished.
Okay. And if you feel like sharing any resources that you think that others can it could be a good use to anyone else, then please feel free to contact Shelby or me or Tessie, and then we can route it into the groups so that others can have a look at it as well.
That's a great suggestion, Shanila, to, share resources that we have between our different countries, especially resources like this, Hazel, where you you're really empowering these families and the patients to problem solve at home and to manage their symptoms at home. It can be really really powerful for us to share those types of resources for with other countries and with especially other institutions that don't have these types of resources. And so Chanel and I are trying to work towards building an education and resource repository online for nurses, and that would be something that would be a great addition to it.
Thank you for opinion, Shelby, sorry.
And if there's no other questions, we just want to really thank you,
Um,
Hazel. We
Thank
have really
you,
positive
Linda,
feedback. Yeah.
and thank you, Vera.
Yes, great feedback in the chat. Everyone really loved
Uh,
your presentation.
I'm so
So
happy
great.
to.
Okay, well, with that, we will see everyone next month. Thank you so much, Hazel, for presenting for us this month, and we look forward to.
It's a pleasure to be with you.
Yes, yes, we appreciate it. Okay, thank you, everyone, and we will see you next time.
Take care. Bye.
Take care of yourself.